Good evening, everyone. I hope everyone can hear me. Let me see. Yeah, I'm not unmuted, so I hope everyone can hear me.
Yes, loud and clear,
Yes.
Dr.
Okay,
Ryan.
thank you very much. Uh, I'm Dr. Ryan Baldomero. I'll be your host for tonight. No, I'll be your moderator for tonight. Today is we will be tackling acne vulgaris. Welcome to the LAMP lecture series. It's very timely because of the heat. I will also be presenting some facts in the chat box of what acne has affected both worldwide. It's a worldwide phenomenon as well as a Filipino one. So it both, you have psychologic, physiologic conditions that then leave somebody scarred for life. And it's really common in adolescents and can frequently be continued in adults. So as you can see, acne vulgaris affects 85% of young adults. So that's like 12 to 25 years old. So it represents one of the top three most prevalent skin conditions, not only in the Philippines, but also in the world. So most of the common skin problems in the Philippines, we from the Philippine Dermatologic Society, about 16 million Filipinos, teens 10 to 18 years old, have acne, and this can affect into adulthood. So most people get breakouts on the face, on the back, the butt, and 15% get on their chest. When not treated, it can lead to scarring. So acne vulgaris is the most common dermatologic diagnosis in the Philippine population. However, that's why there is drug therapy. However, the drug therapy may require several courses and at an increasing dosage. So studies have really led to other treatment modalities for acne vulgaris, such as acupuncture and traditional Chinese medicine, because they do not have or develop resistance factors and are timely and significant in the country. So having a background on that, I would like to introduce our speaker, nonetheless the incomparable Dr. Hector de la Cruz.
Incomparable. Thank you very much, Dr. Ryan, for that very flattering introduction. Okay, good evening, everyone. Welcome to Acne Vulgaris. This is the third part of our LAMP lecture series. And for today, we shall be tackling the pathophysiology, both Western and Chinese medicine concepts, the treatment, and the patient advice. Acne vulgaris is a common skin condition that occurs when the hair follicles become blocked with dead skin cells, bacteria, and skin oils that we call sebum. The blocked follicles cause inflammatory and non-inflammatory blemishes like pimples, blackheads, and whiteheads. Acne vulgaris is the most common form of acne. Increased production of sebum will be manifested as greasy skin. Proliferation of commensal bacteria, in part, is connected with increased production of sebum. Blockage of follicular opening due to hyperkeratosis of epithelium in follicular canal is the basis for comedone formation. So all comedones, they begin as a plug of sebum or skin oil and dead skin cells that become trapped in the follicle. This plug blocks the follicle opening. The sebaceous glands continue to pump oil into the pore, and as it fills with oil, it pushes up on the skin surface. So this is what creates the bump that you can feel and see. Okay, so here you could see an inflammatory reaction to commensal bacteria and hyperkeratosis. In women, increased androgen values may be relevant, especially in association with polycystic ovarian syndrome or polycystic ovary disease. Acne vulgaris manifests as large, deep red pimples with yellow heads. It affects predominantly the face, but also the neck, décolleté, and upper back. The pimples become darker after the pustules heal, and they form deep scars which remain, making the skin seem quite uneven. Post-inflammatory scarring, keloid scarring, and pigmentation can last for over a year. The condition is common in teenagers and is often worsened by their diet of refined sugars and milk products, but it is also seen in adults. Now let's go to the TCM view of acne vulgaris. When you have thick, oily skin, that indicates dampness in the lung and spleen. Deep scars that remain after healing, making the skin look very uneven. This will signify yin deficiency and the fluid being too thick. Poor elimination of skin would suggest lung and large intestine qi deficiency. So if you improve the elimination process, then we hope to see improvement. When there's inflammation, that is excess of lung yang. So treatment principles. Of course, we reduce the dampness, improve circulation, promote elimination, cool the heat, and disperse the heat. Let's start with reducing the dampness. So we do lung 5 sedation. Lung 5 is the Hussey point of the lung channel, and it expels lung phlegm. Or we can do spleen 9 sedation. This is the Hussey point of the spleen meridian, regulates the spleen, and spleen 9 is the point for resolving dampness in the lower jaw. Next, we improve the circulation. We use bladder 13, stomach 40, and mainly local needles. Bladder 13 is the back shoe point of the lung. It strengthens lung qi, spreads and descends lung qi. Stomach 40 is the luo connecting point of the stomach channel. And stomach 40 is very famous as the phlegm point. It helps resolve phlegm throughout the body. To promote elimination, we use the following points: Li4, stomach 25, and Sanjiao 6. But because I am so biased with ear acupuncture, so I will show you the ear versions of the points. Li4 is the yuan source point of the large intestine channel. It is also called the command point of the head and face. It expels wind and releases exterior. It is useful for any condition related to the face and head. Stomach 25 is the front mu point of the large intestine channel. It dispels dampness and damp heat. Sanjiao 6 is the Jing River point of the Sanjiao channel. It regulates the qi, moves the bowels, and it is an important point to use for treating constipation. Next, we cool the heat. What do we use? You can use spleen 10, or you could use bladder 17. Spleen 10 is called the sea of blood. So it cools blood, invigorates and moves blood, benefits the skin. So if you want to have good-looking skin, don't forget spleen 10. And spleen 10, as its name implies, the sea of blood, it's a point for treating disorders relating to blood, like blood stasis, heat in the blood. Bladder 17 is the back shoe point of the diaphragm. It is also called the converging point of the blood. It cools blood, invigorates blood, nourishes blood, and stops bleeding. Then we disperse heat. We do lung 5, venous bleeding, and the use of the lancet needle or the lancet to treat the blood channels is a reference to bloodletting, or you can use this 3-edged needle. The indications of bloodletting for alleviating heat, convulsions, and mental distress has persisted to modern times. We have to advise the patient to avoid dairy products and refined sugars to counter dampness. Treatment would be twice a week for 12 sessions. The highlight of treatment would be the local points on the areas of acne. You have to use 15 millimeter needles, 0.20 millimeter gauge. With the patient lying down, we needle the short needles subcutaneously. Remember, subcutaneously at areas where acne is prevalent. The needle should be given just deep enough to stand and not fall against the skin. The needles are given in the normal skin, not in the inflamed area. There can be up to 50 needles on the face. Leave the needles for 20 minutes along with other acupuncture points on the body. No needle technique is used and no dachi is obtained. This local needling causes the maximum effect on the acne. where the skin clears after each treatment. And the patient will love you for that. The patients love the effect and they never complain about the pain. The results are due to the fact that the local needling causes increased blood flow and circulation in the area. The primary problem in acne vulgaris is the thick and oily skin and increased sebum production from the sebaceous glands. And this is worsened by a faulty diet, which is very damp producing. Refined sugars, milk products, oily foods, and eating large meals in the evenings. The dampness originates in the spleen and it affects the lungs and skin. The point spleen 9 and stomach 40 will help this. Patients should be given strict instructions on what to avoid in their diet. If they follow the advice when treatment begins, they will see a great improvement, and this will keep them motivated. If at any time they return to their poor eating habits, they will see the skin immediately worsen. Often patients ask us how long the effects of the treatment will remain. We can tell them that it will be good for as long as they take care of their diet. There are many of us who have oily skin but without acne. Problems begin when the skin does not eliminate the sebaceous secretions well, and these stay under the skin and create stagnation of dampness. And there could be two reasons for the problem. The first one is when the lung qi is deficient and the skin has poor opening and eliminating functions, so the dampness cannot get out. So in order for you to improve the lung qi, you have to improve the eliminating functions. The second reason would be that the thick fluid of the sebaceous secretion has less thin fluid, so more thick than thin. So this is what we call yin deficiency. And therefore, the fluid even gets even thicker, and this makes the circulation and elimination of the fluid more difficult. This also affects the healing process, and the scars remain deep long after the pustules have healed. The treatment for the first reason, the lung qi deficiency, is to improve elimination. It would be interesting to note that many patients with poor elimination of skin, they also have problems with constipation. Treat the constipation and the skin improves its elimination function. Hence, we use the points Li4, which is called the Great Eliminator, Stomach 25, and Sanjiao 6. Also, you might want to invest, this is very cheap, on a plum blossom needle or plum blossom hammer along the paravertebral line from the level of lumbar 4 to sacrum 4 until there is a red skin reaction, and this will help activate the bowels. So for the skin itself, if you want to have good-looking skin, if you want to improve the skin elimination, we can use points bladder 13 and Li11. So, and wait for the red reaction to come out, okay? Good skin hygiene is crucial in the treatment of acne. Many patients, they use extra makeup to cover the acne, but they do not remove the makeup thoroughly. So this will block the pores and worsen the situation. We should advise patients to clean and steam the face morning and night and to use a light moisturizer afterwards. A facial sauna is also a good idea. You might want to invest on a gadget, which is a favorite. You can use a dual functional ampule that works for both wrinkle care and whitening in one step. The treatment for the second reason, so that's yin deficiencies, you have to tonify. You have to tonify the yin. Patients should drink water, ideally warm, throughout the day. This would thin out the thick, damp fluid of the sebaceous secretions and improve its circulation and elimination movement. Okay, so warm water, not cold. Lung 1 will also help to thin the sebaceous secretions. Or you might want to invest on, this is actually the favorite of Dr. Ryan. Press needles. It's a little bit pricey, but if you want to look good, feel happy, then you might, okay, change this every day. Okay, lung 1. Of course, we also take a bath, diba? So you use lung 1. This is the front point of the lung channel and the crossing point of the lung and spleen meridian. So you put the needle on the, you put the press needle on lung 1. And one good thing about it, it disperses the heat from the chest. And if you happen to be coughing, this can stop the cough. It will regulate and descend the lung qi. And lung 1, being a front view point, is a very important point used in diagnosis and treatment of lung disease. If you have pulmonary TB and bronchial asthma, this point will be very sensitive. Okay? Okay, so you might want to use lung 1 to treat your yin deficiency. Cooling the heat or treatment of the inflammation is done with point spleen 10 or with bladder 17, both of which are excellent points against any surface irritation or inflammation. However, if a large extent of the skin is affected, we can do venous bleeding on lung 5. This can be used once or twice. You don't have to do this all the time. Take note, many patients with acne vulgaris, they take long-term oral antibiotic treatment. The skin flares up very badly when they stop the antibiotics for the acupuncture treatment. Unfortunately, these patients are not good subjects for acupuncture, as we seem to be working on them at the worst possible moment. We would be wasting the precious first few treatments on them when the body has a poor response. It would be best if they stop taking the antibiotic, wait a month, and then come for treatment. And they could use topical creams during this time to ease the symptoms. So our guest, I don't know if he's already around, is a very famous social influencer. When he first came to me, he complained of the acne vulgaris. And if you look at the tongue, it's quite huge, very swollen. It's very dampness. And you could see some, what's this? Red spots there. So there's too much heat. And after 5, this is actually I took a lot of pictures, but this is how he looked like after the 5th session. Okay, so if you look closely, there was a big improvement on the tongue picture. So treatment protocol, to summarize, to reduce dampness, we use lung 5 or spleen 9. To improve circulation, bladder 13, stomach 40, and local needles. Promote elimination, Li4, stomach 25, Sanjiao 6. To cool the heat, spleen 10, bladder 17. To disperse heat, we can do lung 5 venous bleeding. And if the lung qi deficiency is so obvious, you can add Li11. And yin deficiency, if you see that the skin doesn't look so good with lots of light, with lots of, they usually have dry skin, yin deficiency patients. You can use lung 1. Thank you for your attention.
Our guest is trying to log in. Apparently the link does not work, so I am giving him the details of the
Okay.
meeting and what do you call this, the ID. So I don't see any questions from the chat box. Is there anything that anyone would like to add or experience about acne? I did share the facts that I presented earlier, as well as the references that I got those facts from.
Yeah.
So anybody can, copy and paste into their notes or in their, what do you call this, or do a screenshot.
Very impressive research. Wow, with references. Okay, so because we've seen a lot of patients who feel so frustrated, even after consulting a lot of experts, after spending a lot of money. So I feel that it doesn't have to be that difficult. And I always believe that diet has a lot to do with it, and also emotions, no? Or maybe what we should be careful about is the dampness. When we think too much, that actually depletes a lot of our energy, a lot of our chi. And so you end up having a very weak spleen function. And we all know that when the spleen gets weak, there will be a lot of dampness. And this will set, this will start a lot of problems later on. Questions? Huwag na kayong mahiya. Okay, this is very common actually, and if you ask me, I'm not really very keen on using anything on the face. I don't know what your take is, because I've seen a lot of people whose face is worsened after applying too many products on the face. So I think this all boils down to looking at the kind of food that you eat, the kind of lifestyle, okay? Yun. Any questions?
I don't see any question from the chat box. You can just unmute yourself. It's very informal.
Okay.
Hi, Doc.
Oh, yes. Good afternoon po.
Magandang hapon po. You mentioned that you used 15 millimeter needles subcutaneously for about 20 minutes.
Mm.
So is that for the face or for the other points also?
No, only for the face. Remember, needle on the face is only needled subcutaneously underneath the skin. So 15 mm is not a very good needle for the body, no? And always avoid po the areas that are inflamed. Of course, may natitira pa naman sigurong skin na maganda na normal, no? Yun. And do not exceed 15. I don't know if that's a lucky number or what. It's just that we don't like the idea of putting too many needles.
Okay, thank you, Doc.
Thank you. Remember, it's enough na nakatayo lang yung needle. You don't have to needle it. Sub-Q, you don't really needle deep. And that's actually the highlight. I always do that the last. No? And even if it hurts a little, the patient will not feel the pain because he could immediately see right after the treatment the improvement. So always invest on a mirror, small mirror, or probably you take pictures. Yeah. Okay na po, Sir Victor. Are you excited?
Salamat po, Doc.
Salamat. Of course, you don't have to forget. Some people, they just do but you have to follow our protocol. No? And diagnosis is very, very important. Look at the tongue. Yon. So I guess we have
Our guest is here.
yeah. So are you, congratulations to our guest. He just won a title in a male pageant. Congratulations. Although he would have wanted to win the top crown, but I said it's being a first runner-up is an honor already. Congratulations.
Thank you so much. Hello, everyone. Good afternoon. Hi, Sir Ryan. Hi, Doc Hack. Good afternoon,
Hello,
everyone.
hello. So you missed our twice a week treatments because of your very busy schedule. So how was it so far? Like,
I actually,
yeah.
I honestly miss the pain of the needles on the skin.
The pain.
At first, I've been used to it. It's not that painful, but the pain is kind of different because it's satisfying and it's therapeutic, especially when you get accustomed to it. Then you'd eventually know that there's been a difference on your face. And for the past sessions that I missed, honestly, I have not breaking out been so far.
That's good.
And yeah, it's just different this time because before, every time I wake up, especially with the makeups on, especially that I've been so stressed this week, I would expect breaking out. But if you would notice on my skin, it's different. It's though I have been lacking, to be honest, I have not had 8 hours of sleep this week, everyone. But Doc Heck, because of acupuncture, it really has helped me so much.
Wow. Thank you. And we hope that you really love the treatment. And can you tell us a little about, like, if I'm not mistaken, that you did not have that kind of face before. I hope you don't mind the pun. Okay. If you were saying that you have had it for like 7 years, and you were diagnosed to have a heart issue as well.
Yes, Doc Hack. So, allow me to share a personal experience of my acne journey. This experience is literally firsthand. Since I was 18, I am 24 years old. So, allow me first to introduce myself, Doc Hack, before I
Okay.
carry on with this personal sharing. I am Jose Fernando. I'm locally from Dumaguete City. I lived here for almost all of my years of my life. So I am a alumad or a local in the city of Dumaguete. So Doc Ek and I met for quite some time. I believe it's been 3 months, Doc Ek, right? Yeah, so when I first met him, I was different. I looked so different. I look so, I must say, yung haggard na face, ang daming acne. Tapos you wouldn't expect that this up right now is achievable in 3 months. Now moving forward, ever since I was a teenager, since 8 years old, I had like literal acne vulgaris, like
Mhm.
big cystic acne on my face. I even had so many sessions. It's been one of the biggest insecurities I've had. First is um, it all started with using this typical rejuvenating set. Yung I'm not sure if I'm allowed to say the product, but yung rejuvenating set na may toner, tapos night cream. And I
Mhm.
didn't know my face was so sensitive. So it triggered to yung lumabas lahat ng acne ko.
Yes. Okay.
It all happened suddenly that in 1 to 2 months time, lahat ng acne ko lumabas, like cystic acne. From then on, for almost 7 years, I've been carrying this insecurity.
Mhm.
I even had plans to consult different doctors, especially dermatologists.
Mhm.
Now, one time before I went abroad, I had scholarship in Thailand. I was diagnosed. I went to a doctor, a dermatologist, and she gave me this Accutane. It's one of the most, I must say, the strongest medicine for acne
Mhm.
na meron siyang meron siyang consequence dahil mag-dry yung lips mo.
Mhm.
It's a risk because there's possibilities na ma-affected yung eye mo because of the medicine itself. Now, nawala yung acne ko for quite some time. And
Mhm.
then when I went to I took the Accutane for only 2 months. When I went to Bangkok, I had gluta drips, I had vitamin C. My skin was really, really smooth. But siguro nag-adjust yung face ko when I went abroad. I got back here in the Philippines after
Mhm.
2 years. Now coming back here in the Philippines, that's when I realized it's really the weather here in our country. Na I
Okay.
think na affected yung pores ko. So my pores, I just so you would know, my skin condition is really oily to heavy kind of oily skin. So I've been doing researches, I've been trying all of the kind of products. Then COVID-19 pandemic hit. So TikTok came around. So when TikTok boomed, I saw so many natural remedies. They say aloe vera, the coffee, the egg, the apple
Good idea.
cider, done so many things on my face. And I have had one time, I'm
Mhm.
sorry, nag-cut off. So one time in my life, allow me to share this experience. I was still studying back then. Now, my friends would usually ask me what's happening on my face. So, uh, ethically, basing it on ethics, I must say that it is not okay to point out someone's insecurity, especially if it's not addressed immediately in a snap. So that person basically knows he or she has acne problems. Though I may not have any acne problem, wala talaga akong acne on the body. I have clear skin sa body ko. It's just that on the face. Pero I myself, as a content creator, as a person who really utilizes social media so much, and I also do events hosting. So I am much exposed to different people. I am exposed to different personalities every day. So it is important to really look good.
Mhm.
Now, I more than just knowing why it is important to look good, you have to really feel good inside. So when Doc Heck and I met, I never had any idea of what acupuncture is.
Yeah.
So as a person who is a risk taker, before Doc Heck and
The
I met,
doubts.
I've had 3 months of Erbium. It is an eye pixel non-invasive laser which costs me 60,000 in total for 3 sessions in 3 months. So that's basically 20,000 per session. So the aftermath would be susunugin yung skin mo. Uh, if you would notice, if you would zoom in yung picture, meron siyang square, so it's basically pixelized. That's why it was coined from the word pixel. That's why they call it eye pixel.
Mhm.
So same still here in the city, I met a dermatologist too. Now, he got my white blood cells and placed it on my skin. I'm not sure what it's called, but like just from a personal experience, it did work for me. But I have experienced
Nawala siya.
hello,
Yeah. Yeah,
can you
you're
hear
back.
me? Yes, I'm so sorry. Medyo umulan kasi dito sa Dumaguete, guys. So medyo problematic yung signal. But anyway, now moving forward, what happened was it did work for me for quite some time. Let's say siguro mga 2 weeks. 2 weeks my skin was very clear.
Mm.
It was literally um smooth, parang nag-baby skin pero meron pa din yung deep scars.
Mm.
Now, after 2 weeks, I would notice small zits would come out every day. So sabi ko, Doc, why is this happening? So sabi niya, I think that's normal kasi nagre-renew yung skin mo. Then, as I do my research, when
Mm.
they said non-invasive laser that is just topical or just on top of the most top layer of the skin lang yung
Mhm.
tina-touch base nila, that does not show any sustainable progress or sustainable healing, right? So now let's go to Doc Heck and how Doc Heck and I met. So my friend introduced me to Doc Heck in RKB. So this RKB house, I've known this for a while, but I haven't tried any sessions in this clinic. Now this wellness center I got into, Doc Heck and I had good conversation. Now, the conversation eventually ended up to how I got my heart issue. So
Mhm.
just so you may know, I will disclose this. I have a mitral valve prolapse.
Mm.
It's a benign condition. It's not fatal, yet it is disturbing because I experience chest pains. I easily get dizzy. I am caffeine intolerant. So bawal ako ng kape. So kung sino yung hilig ng kape dito, disown me, pero I don't drink coffee anymore.
Okay.
Um, so yeah, so that's it. So
Mm.
bawal din ako ng mga intensive, extensive workouts or work. Pero
Mm.
siguro gradual lang probably. So I've been drinking my maintenance as early as 24 years old. I've had digoxin. So it's like blood thinners, helping the heart to process and to do its job and its work. So I've been working that out. Now, when Doc Heck and I met, he introduced me to this ear acupuncture. So this ear acupuncture, he once told me that, sabi nga niya, okay, I will sedate you this time. So I was like, I am new to the word sedate. The way I understand it
Um,
is parang sedate using injections, parang ganon. So parang ganon. So I trusted Doc Heck from the very first moment we talked. And the ear, he once told me that uh, it is as the same as the human body. It's just that it is the ear. So sabi niya, now once you target the ear, it's basically it's basically targeting the entire body, but not immediately to your body. So he's been telling me about spleen 24, lung 5, everything in between, which I do not understand.
Okay. Yeah. Ang hina talaga.
But trusted the process. He's
Okay.
being to see differences. Yeah, Doc, can you hear me, Doc?
Yes, yes. Mm. Yes, I can hear you.
Yes.
Yes, we can.
Ayun. So I was checking out with he literally acupunctured all of the parts of my ear. So I'm not sure. I'm gonna send some of the photos right here for proof. And also I'm gonna send here on the message section my picture before. So Doc Heck has been documenting from the first session to the most recent session we've had, which was last week because I've had no sessions this week. Now he's been acupuncturing my ear, so he said that there's gonna be differences. So number one, we won't target the face alone, but we will target the internal feeling. So I have been stressed out with full-time job. I have a small business. I have been hosting in the events industry, and I got myself back to school, financing my studies. So now I am literally with all the five of these responsibilities. It really got stressed me out. It really got me stressed out. Now, when Doc Heck checked my tongue, I was like, Doc, what's that for? So ano bang relevance ng tongue with ear acupuncture? So, sabi niya, if an acupuncturist wouldn't check your tongue, basically, parang binubudol ka lang niya. Because you would know if an acupuncturist is an authentic acupuncturist kung hindi niya check yung tongue. So my tongue, he checked it out. So I've had it documented as well. Merong mga bumps tapos mga red lumps. So sabi niya, what does that indicate, Doc? That only shows na ikaw ay stressed, madami kang iniisip, madami kang problem inside. So sabi ko, how do you know that, Doc? So also, when you are an acupuncturist, you really have to know siguro how to talk with your clients. So I and Doc Heck, I've been so, I've been so calm and at the same time light every time when I'm with him. So after the second to third sessions, I noticed I've been secreting phlegm every single morning. Tapos I'm not a morning person before we met. Pero I noticed I woke up every day early morning na. So sabi ko, what does that imply to me? So after I believe the third session, so he did me 3 sessions, two sessions in 1 week. So that's basically after 1 week and 1 week and a half of the week. Doc Ryan and I met because he was having an acupuncture session as well.
Okay.
Now, he told me that he's been had this acupuncture sessions for quite some time. Doc Ryan, he let me see a photo of him yung before the acupuncture. Now, sabi ko, wait, is that you, Doc Ryan? I didn't even notice you. So sabi ko, how old are you, Doc Ryan? So sabi niya, he's this old. So I was like, are you serious, Doc? Na this is your age? So technically, if you would meet Doc Heck and Doc Ryan in real life, you wouldn't know that that's their age. So now, um, after the sessions we've met, Doc Heck, I told Doc Heck, Doc, I'll be joining this stuff. I'll be having a pageant, and also I'll be trained to a celebrity gig, sabi niya. Now, sabi ni Doc Heck, okay, so let's place the ear acupuncture on hold for a while. let's focus on the traditional acupuncture. So when the traditional acupuncture came in, sabi ko, what makes this different from the ear acupuncture? Sabi ni Doc Hek, this goes way different than the ear acupuncture because this one's more traditional and mas drastic yung changes. Drastic meaning mas madali yung effects niya. So sabi ko, okay, let's give it a try. So I got scared because Doc Heck will not only acupuncture the ear but the entire body. So the first session, he acupunctured my back. So I thought to myself, it's gonna be a risk because um siguro I have high tolerance sa pain. Pero yung mga people na hindi gaano they're not used to the pain, siguro they would be scared of it, 'di ba? But then when you get used to the pain and understand what's it for, you will eventually know that it's therapeutic. It's beautiful kasi I've had back pains, I've had stress feelings, I've had so many things in mind. I even had my heart broken during the sessions with Doc Hector. Pero it has really helped me a lot that the traditional acupuncture in itself, from the back to my legs, to my hands, down to my toes, in acupuncture niya talaga. So I have learned so much that it really got me interested with acupuncture. And then I've dated a doctor too. So that doctor, I asked him, ano bang benefits ng acupuncture? Sabi niya, I would even trust acupuncture than chiropractic. Sabi niya, because acupuncture is more traditional. It has been observed. It has been studied way long back. Yung chiropractic lang, it's been studied recently, perhaps couple of decades, but it's not compared to the traditional acupuncture. So sabi ko, as I do my research, then uh it's life changing. So when I told myself this is not just healing, it's an internal life changing. Like it's a holistic approach of targeting yourself, that you wake up a whole new different person. So the sessions I've had with Doc Heck and together with Doc Ryan, it would only take me siguro an hour. Tapos after an hour, merong bleeding, small bleeding sa face, but that only shows na it's good kasi madaming heat sa body mo na sinisecrete. Tapos after the bleeding, wala na. Doc Heck does get washa on my face. Now, after that, I feel renewed. I feel a whole different person. Kahit pa I've had 6 hours to 5 hours of sleep lang, parang I got off from a 2 hour whole body massage after the acupuncture. So I haven't had the electric acupuncture yet, pero I've been loving the traditional one. So to all of you guys here, I'd like to firstly thank you to Doc Heck for introducing me to acupuncture, and of course to Doc Ryan. How could I forget? Doc Ryan has been so therapeutic to me as well. It's been helping me out with everything. So I am just so happy that our paths bumped at each other, because if it weren't for them, honestly, before I end my speech, allow me to share this one. I have heart problems, right? Pero for the past sessions I've had with Doc Ryan, Doc Heck, I feel like though meron pang chest pains, pero it's not as grabe like before. It's not as worse as before because before I stress out, tapos I get so dizzy and merong tingling sensations. But right now I would notice if I lack sleep, I would just feel na parang heavy yung self ko, pero I can sleep immediately. Tapos yung sleep din, it's different now kasi I have discipline sa sleep ko. I don't know how does this affect Doc Keck and Doc Ryan, no? Pero yung changes talaga ng lifestyle ko after the acupuncture sessions, it really had me so, you're crazy na parang hindi mo expect na this is a kind of person you can be. So yeah, I'm just so grateful and thankful as well. And for everyone here today, thank you so much for listening. I tell you, acupuncture will not only affect the internal or external healing, but It really does target the internal and holistic healing. So looking forward to more sessions with Doc Heck and Doc Ryan. Thank you so much.
And congratulations
Congratulations.
for winning. I knew you wanted more, but I think the universe had other plans for you.
Yes. Siguro, Doc. Siguro, Doc.
Yeah.
Hopefully lang we
Napakaswerte mo
have.
naman kung ikaw pa mananalo.
Sayang, Doc. I was just overwhelmed during the last question and answer portion.
Okay.
Pero siguro I'm destined for bigger calls. The questions were really hard. Na if you don't study anything, you can't answer it. Siguro I have videos right here, Doc Heck. I will let you see in the next section.
Sige. Congratulations again. And I hope to be able to see you next week for so it's time to go back to reality.
Yes.
Yeah. Thank you so much.
For
I know you are very busy.
you
I
so
think you
much.
have a ball to attend. Your
Yeah.
speaker's ball. Okay. Thank you so much.
Yeah.
Thank you.
See
Thank
you
you so
soon.
much, everyone. Thank you so
Thank
much, Doc
you.
Heck. You may also like my face. So if you have questions, guys, if you want to ask me about acupuncture, my personal experience, you can just message me there. Let's be friends.
So Jose Fernando, he's actually the Jose Fernando. He would
Thank you.
accept, I don't know how much the rates are, but if I'm not mistaken, he's one of the most sought after events or host, whatever you call it. And he's still a student, but his gab for public speaking is world class. Thank you so much.
Thank you so much, Doc Heck and Doc Ryan.
Yeah,
Take
thank
care.
you. Take care. Bye-bye.
I saw a couple of questions at the chat box that addresses the kind of books, and I think it's already been addressed. Let me see.
Yeah, I
And I think
cannot
that's
remember
it.
the titles. Yes.
Yeah.
Okay, I would like to clarify now. So I'm sure most of you are familiar with the acupuncture ebooks
Mhm.
that most people use. I became so obsessed with one particular precise pocket atlas or something, and that's where I discovered that you have all the meridians on the ear, that the points, the ear charts that we usually see are just tonification points. So that's why our points are a little bit different. But again, there has to be a prior background on ear points, on acupuncture point categories. So that means you need to be very familiar with the basic principles.
Mhm.
Yeah. Ay, wow. Ma'am Rosemary, hello po. Looking young. Ay, baka naman malabo lang yung mata. Thank you po. Okay, so I guess we have no questions. Wala talaga. So Sir Albert, kindly provide the titles. We have actually lots of books, modesty aside. Mas maganda kasi marami kang sources. Thank you. So, Dr. Ryan, would you like to add
Nothing
something?
really. Nothing to add. Only that I went ahead and posted the references to the
Yeah.
sources that I have, just in case you can copy and paste and keep it for your, And again, whenever you receive information, always verify what do you call this, the references, because it'll be up to you to look into the details.
Yeah.
So the title of the book on the chat is Ear Acupuncture, a precise atlas based on works of
Okay.
Nogi and Bar.
Noge, yeah, and Bar. Yeah, thank you
Noge.
very much. And also, when you deal with people like Dr. Ryan, make sure that whatever facts you would like to share can be confirmed, because he would always double check. And amazingly, he learned acupuncture the weird way.
Yeah, my own way of learning, but it works. It works.
And he has 2, 3 doctorate degrees. Amazing. And he's working on the 4th one.
No, just
And,
one.
and
Just
he's
trying
also
to
a
work on
very good
others.
chef. I consider him a gourmet chef.
I love to eat.
it doesn't show. Thank you. So wala
Thank
na pong
you.
ano. Okay,
Wala.
if there are no questions, we would like to invite you again next Saturday. That would be, yeah, March 16th at 5 o'clock. Our topic is sublingual veins inspection.
Yes.
Okay, and I feel that this is very important because all of us have tongues, and all you have to do is look under the tongue and see if we have issues. And the most amazing thing about tongue diagnosis is you could actually uh, monitor your progress because you will have you will see changes on the tongue. Now, why am I so excited about sublingual veins? Because it will tell us a lot about possibilities of heart, lungs, and breast involvement before they show up. Okay, and we will be studying all the different pictures of sublingual veins, and there is also a need to know the different patterns. And we hope that through our lecture series, by the way, for the information of everyone, this was the idea of Dr. Ryan. He hates listening to long lectures. That's why I try my very best to really super edit everything that I give.
The only reason why I say that because I believe in a group is that we learn from each other and we learn with the interaction. So whether it's just a single nugget or two of information, I mean the information that will stay. And I believe in brevity because now we don't like you can hear lectures which is condensed. However, it will also be up to an adult learner to look into
Yeah,
the depth of the lecture, and I believe that's how adult learning should be.
yes. And you have to do multitasking, just like Dr. Ryan, who also gives conducts classes. Yes. And by the way,
Alright.
Dr. Ryan is also a researcher, statistician, whatever you call him. And you just have to be honest with yourself.
I think the poster is already up, and we will be sending the posters through the different chat groups that we have for next
Okay.
Saturday, March 16. It's at 5 p.m. And we always look forward to this interaction because we know, we always have to grow in a field wherein, there's a lot of things that we can learn from and learn from each other. And I believe I'd like to thank everybody that's here because I know that you are led to being here because we always are led to people that we can grow the most. And then by doing so, we also can help others. So we always appreciate you, Dr. Hector, for all the work that you've done, the input that you have, and the knowledge that you've shared. Because knowledge will beget skill, and skill will lead to correct attitude. Because we need to put acupuncture in the spotlight. It's about time.
Yes. So thank you so much, Dr. Ryan. Thank you, everyone, for joining, and enjoy the rest of the weekend.
Yeah.
Good night.
Have a great weekend, everyone. Have a good
See you
night.
next week. Bye-bye.
Bye.
Thank you, Doc.
Thank you po. Thank you very much.
Thank you so much.
Thank you, Ma'am Rosemary.
Thank you po.
Thank you,
Thank you
Doc.
po.
Thank you.
Ayan.
See you next week.
See you po. Salamat po. Maraming salamat. Bye-bye.